Hey guys, it's 9:40 at night. Day one. I'm a sleever. Um, I'm allowed to chew on ice. Well, let it melt in my mouth, but I'm out, and so um, my throat's pretty dry from my respirator thing. I've been using my incentive spirometer and my biotine or whatever for mouth comfort, and my lips aren't too chapped right now. I've been sleeping a lot. Danielle left a little earlier. She left at like 7. It's an hour and a half drive, and she had to eat, take care of the doggies. But I just got some medicine from the nurse. I got my blood thinner shot in my tummy, which, as you might or may not know, getting a shot in your stomach after this doesn't sound like the most fun thing, but it actually wasn't too terrible. And I got some Pepsid AC in my liquid IV form. I keep asking to walk. I haven't gotten out of bed since they put me in a gurney for surgery for pre-op, and they told me it would be around 10. So we're closing in, and I just FaceTimed with my wife and told her I'm feeling a little less lucid, or more lucid. I don't know, less foggy, more here. So it's probably why they make us wait. Unfortunately, my nurse is like freaking 4'10", and this little Asian lady, she's nice. But there's no way I can sit up on my own right now. So I asked her if she would get some other people, another nurse, to help me get out of bed. But looking forward to walking, and been chatting with a kid from high school. I didn't know him too well, but he had our gastric bypass years ago, and he's been incredibly successful. So I've asked him and talked to him a lot, even though things have changed drastically and we had different surgeries, but he's keeping me company a little bit and sharing stories. And one thing I realized while talking with my wife is I haven't gotten nauseous at all. I could get seasick in a bathtub, but with my shoulder surgery and with this, I haven't had any nausea, which is fine by me. A little morphine pump. I just did a pill, or I did a shot. You can see it beeps or blinks when it's available every 7 minutes. Freaking awful siren was going off as I FaceTimed with Danielle. But I had to page the nurse to turn it off. But basically my first bag full or whatever of the medicine is almost out. So we'll be swapping that out, I guess. But I'm anxious to get up and walk, get some more ice. I give a little goodie bag here. I haven't opened it yet. I haven't found the need. But I've got a toothbrush and toothpaste and a comb. I don't know what that is. It looks like a dog poop bag, but I'm sure it's not. It might be a eye cover and some earplugs. I brought a lot of this with me. I even stopped and bought some nice earplugs. It's pretty quiet in here, if you can hear the little IV doohickey. I'm in a private room. I have a TV. The view might be pretty nice outside the window. I was trying to look a little bit earlier, but I didn't really care. Catheter's not really bothering me. When I first woke up, I was in excruciating pain from surgery, and my nurse sucked. She didn't really speak English, and I couldn't even talk. I was hurting so bad, and I finally voiced my situation of being in so much pain, and she asked me what I wanted her to do, and it's like, well, I don't know. Maybe give me a shot. So she gave me a shot, and then it like barely helped. So I don't know how late or long it was till I asked her for more, and like she would kind of just do her own thing and give me another one. I don't know if there's like a time requirement or what, but I did not like that lady. And then finally, like, she gave me one more, and I could have used a fourth, but I didn't feel like dealing with it. I didn't feel like my stomach was on fire and just in terrible pain, so I just let it ride. And then Danielle got to come back and stay with me for a little bit, and then she left, and I guess I was in there for a long time. And then the nurse wanted to transfer me up to my room, and I remember her asking for help with the transport, and like everybody was like, I'm busy. And finally, she wheeled me halfway into like this walkway, and people were like walking by me and bumping me, and like she wheeled me. Finally, this guy was like, you know what, like the computer's not letting me buy the stuff I need to order supplies, so I'll help you. So they moved me and freaking bumped me into walls and stuff, and get to my room, and then they're like, all right, you have to transfer beds, which is awesome. So they raised mine up and put me next to my new bed, and I was on some kind of plastic sheet, and it was stuck to me, and my gown was stuck to me. I'm pretty sure I showed my berries to everybody full on, but they're like trying to shove me and like pull me, and the one nurse lady that I didn't really care for was like unhooking a lot of my attachments, and they were all bound, or not bound, but like interlaced and stuff. And instead of like taking her time and untying, unraveling it, she just starts tugging on stuff, and I'm pretty sure I said something, but my next couple nurses have been fine since then, and it's been good. Every 4 hours I have labs or vitals or whatever, so check my blood pressure and temperature, so that'll be at midnight and 4 a.m. And then I don't know how often I get shots and stuff, but once a day for the blood thinner. The Pepsid, she said the first 2 are liquid and the next one's a pill. So tomorrow I get to start drinking. I have to do 2 ounces an hour. I'm gonna do my spirometer. Oh, to the top, buddy. Surgery was fine. I got actually kind of emotional. Like, I almost cried a little being wheeled back. That nurse was really nice. She was funny, and she did a great job carting me through everywhere. Granted, I wasn't sore yet, but when we get to the emergency room, of course, it was the last one on the end, and it was really cold. I've been really cold lately, and as soon as we got in there, I was like, whoa, and I asked her, did you give me something? And she was like, yeah, man, I hit you with a Valium or something, injection. So I was really relaxed, which was nice. I can't remember if I had to help them move me to the surgery table or not. I think I did, but they put a mask over my face and had me take some deep breaths, and I know they were supposed to give me a shot of the stuff that Michael Jackson died on, but it never hurt. All I've heard about is how bad it burns, but nothing burnt. And then, they were telling me deep breaths, and I asked them, what about counting? And they were like, yeah, sure, you can count backwards from 1310 or 13,010. So I got to like 13,007, and then I just remember closing my eyes and like not being unconscious, but being unconscious. And then I remember waking up in recovery, and that's when my little session of hell started. I got 5 incisions, 1 in my belly button. I haven't seen those before. But I guess everything's good. My skin's super sensitive to the touch. Even having my gurney or my dress pulled up, it makes it kind of spasm, and it hurts. And my catheter's good. That was like my biggest concern for this is I don't know, just having someone fondle my goods while I'm unconscious. I don't know. But I didn't even know they did it. And when I first woke up, I really, really had to pee. I don't know if I had to pee or if it was the pressure of the catheter not being familiar or what, but I kept trying to ask this lady, this freaking nurse downstairs, and she was no help. I wanted to know if I'm supposed to push or just let it happen or what. And I don't know, I ended up having to ask my nurse up here, and she said, you don't have to push, it just does its thing. So man, my mouth is so dry. I wish this was more of a mist than a squirt. In fact, that's probably what's above my pillow. Yeah, it's absolutely what's up here. That's good. I brought my pillow from home. A little slice of comfort. But I don't know what else. I just really hope I get to walk soon. I want to get up and move. I don't have any gas pain, pressure on my chest or shoulder yet. They said I will, but it happens when it happens. But short of the initial